homes are all about giving patients access to appointments, referrals, or information when they want them. Personal preferences are taken into account when scheduling appointments or communicating with the patient.
The medical home has allowed us to try and think more broadly about how we deliver care to our patients. We deliver care more in a team-based fashion, so that I think access has traditionally been thought of as how can I get someone in for an appointment, but really when we think about what a patient needs, sometimes it's more than an appointment. Maybe they just need a medication refill. Sometimes they need a referral to a community organization. I think that patient having access to the care team and access through different communication methods, be it telephone, sometimes through electronic communication. Sometimes they don't need to see me, the doctor, sometimes it's the nurse, sometimes it's a care coordinator. There's different people or different roles that can meet a patient's need.
The care coordinator is a central figure in the healthcare home. They get to know each patient well.
One of the situations that we noticed is oftentimes our patients would call our patient service center, which is our centralized call center, and they would try and get a same-day appointment. And at times they were easily able to get a patient in, but at other times they were not able to get a patient in. And so they would send a message to a triage nurse. The triage nurse would then send it to a clinician. The clinician may or may not be able to work them in. Many hours may have gone by, and so oftentimes our patients were not getting the patient appointment that they wanted. And this really did not meet our healthcare home guidelines. So we wanted to see what could we do at the Eagan office, and what we chose to do was to implement a patient flow coordinator.
My job is to find spots for patients when there aren't any available. A lot of times the call center can't get the patient in, so they'll call me, they'll warm transfer the patient to me with a little brief history of what's going on with the patient, and then I get further details. If I feel that patient needs to talk to a triage nurse before the appointment is scheduled, I'm certainly able to talk with a triage nurse and transfer that patient there. Say it's for a severe headache, sudden onset, that would not be something that I would book for that day appointment. That's more urgent and needs to be triaged. So say they have a cold, or they're just feeling under the weather, and they want to see a certain provider, and that time is not available that day. I will actually go talk with the provider, giving him the symptoms and the details on that patient, and seeing if he can work that patient, he or she can work that patient in. If they can't, I'll go to each and every provider to find a spot for that patient.
I have the time. I get to go and meet them, and I get to hear their story. So sometimes they don't feel like the physicians always have the time to spend with them to make sure they're getting listened to for changes in their lifestyle or changes that they have in their financial situations. So I get to know those patients and to know their story and be able to help them and their physician and their entire care team work together to make their healthcare experience a whole one, or to make sure that we're not missing anything.
We've got much better communication. We're right there when the doctors come in, and also when the phone calls come in to my coworkers, I'm right there and I can intercept or oftentimes offer some advice that maybe they weren't aware of, that maybe saved them from sending the note to the doctor. So I think it's really improved our teamwork and the way we work together. For example, I just saw a patient today, and I was supposed to review labs, review his diabetes. And after we started talking, I realized that that was not his goal. His goal was to tell me about what he's gone through in the last year with taking care of his wife, who's has a lot of complicated problems. They're not able to get out. And I realized that he was much more of a healthcare home patient, and that his diabetes was really the small part. And we talked about transportation issues and food issues and family, and I probably wouldn't have had the time or taken the time to get into that kind of detail before.
Patients and their families feel the difference between a traditional clinic and a healthcare home.
Kind of the speed of getting the resolution is kind of, it has improved so much after Jamie's involvement. So that is a specific way in which like Jamie was able to help us in our interaction with Dr. Amy Bird. And we feel more connected because of that.
Patients give positive feedback to healthcare home staff about their care and experiences with the staff.
You know, we know who those patients are and we're available to them, and that's just a great thing for healthcare, for the patient to sit down and say, I don't understand what my insulin regimen is. Very clearly, they can make a call and get through right to Erin and get all those questions answered right away. So it's just, the healthcare home is just an amazing system. I really am glad to be part of it, and it's really fun to see the response of our patients, and everything is just a really positive thing with that.
Patients feel more supported and confident in the care they receive.
And I was put on a drug, kind of a potent drug called warfarin, which has a lot of things that you need to know about it. Well, you're in the hospital, and then a team comes and they bring all their paperwork and they tell you all about your drug and what you can do and how you do it and when you get your blood tested. And I go, okay, well, leave the hospital, and I go, oh my God, I don't know if I remember, or I'm scared to death about what I should do. So that's when I got hooked up with my care coordinator here, and Erin, and was able to get an hour of her time. We sat down and she went through all the paperwork again. And that really made me feel comfortable, because when you're kind of in an area where you have some concern, you want to really make sure you're doing the right thing. And that really eased my whole approach to, you know, having that person right there that understands what's going on. And it doesn't always have to be your doctor. I mean, you don't need to always schedule a doctor appointment and free up their time, I believe, if you can use these care coordinators.